Good morning, and thank you so much for coming out this morning. Gee, it's a pretty bitter, cold morning. I feel like we're in Scandinavia this morning. They're dark, and you arrive and happen upon this beautiful location. And so I really appreciate you making the effort. My name's Lish Fayer, and I'm your MC today for one of our industry breakfasts here with WorkSafe ACT. They've been so fantastic, and it's my pleasure to be part of it. Before we start, I'd like to acknowledge we are meeting on Ngunnawal country this morning and pay my respects to their elders past and present. And really, I really appreciate the knowledge that they've shared with us. Now, before we start, I'd like to get you to start. Eating breakfast, ducking over to the coffee machine, please eat as we go. I want to hear the clattering of plates and clanging of cutlery because this is a workplace breakfast and we want you to enjoy the catering as it goes. For the housekeeping, you do have to brave the weather again. If you want a bathroom, they are out these doors and then into the main lobby of the hotel and then find the green light for your way back. We also want to remind you to take the fabulous merch that is WorkSafe ACT. There's bags, there's notebooks, there's wonderful communications materials for your workplace as well over here at the front desk. So please take all that back with you. And also to remind you that we are recording this event for future use. So please be aware that this event is being recorded for content purposes with the aim of being distributed publicly in the future. So please reach out to a team member should you have any concerns regarding the filming of this event. And this event may contain graphic descriptions of injuries and other potentially upsetting or triggering content. Attendance and participation discretion is advised, and please prioritise your mental health and seek support if necessary. Now, you'll note that we've also got a QR code on the screen. We really love your input into these breakfasts because you are the ones who are working, you're the professionals in the fields we're talking about. So we would love your anonymous input. Just scan that QR code, and when you scan it, you'll be taken to Slido, and you can just join there. And during our speakers, craft your question and hit send. Give a comment, give feedback. You can also vote for questions. So we triage the questions as we go. So if you like a question and want it to float to the top rather than something that's not as important to you, just vote, give it a thumbs up, and it rises to the top of the queue. It's like cream or scum. I think both rise to the top, weirdly. Nothing like scum before 7 o'clock in the morning. Okay, let us kick this morning off. We have a wonderful event for you today. And as I was thinking about workplace, the industry of healthcare and education, we're heading off to work this morning. Some of us are already at work thanks to the WorkSafe ACT staff for putting on these wonderful events. But most of us, there's a predictability about what you're going to do in the day. But when you're working with humans, as you do, there is a great level of unpredictability of what you're going to get in that day ahead. And that is extraordinary for most of us to try and comprehend of what you are going to encounter that day. You don't know. And so as health and education leaders and professionals, you in the people business, in the human business, in the caring business, because primarily that's what you are doing is caring, everything is thrown at you because you get the best and the worst of people. But you've got to hold that line. And if I've learnt anything over the series of these breakfasts is that risks associated with each industry are pretty unique. And I think the growing hazard of occupational violence and aggression and abuse directed at those from who you are caring for or even working with is something that we really want to focus on today, because the knock-on effect of that to your health, physical, mental, emotional, and then all of that, the ripple-on effects of that to your family and friends and life are huge. It's not as easily addressed as a plate of donuts at morning tea. And so that's why we put on these breakfasts, because we have to go beyond that. And so today, as essential workers, we found out that term of essential workers during COVID, and you truly are essential. We are so desperate for you to be part of that. We cannot get enough of you, literally. There are so many jobs in healthcare and education. So we need you. We need you to be healthy and safe. So you want to come to work, you want to stay at work, you want to go home from work feeling wonderful and be safe. So kick it off. 3 speakers. Jackie Agius, Work Health and Safety Commissioner, and our host today. She's also the Labour Hire Licence Commissioner. We've got Professor Maureen Dollard from the Australian Research Council Laureate Fellow. She brings a wealth of expertise in psychosocial risks and how we can manage them. And then on the coalface, Tim Cleary, who's the principal at St Edmunds College here in Canberra. So that's all coming up. We have our speakers will give you a presentation first, and then we'll have a quick break to get another cup of coffee, and then we'll have a panel discussion. So let us start. I'd like to first welcome Jackie Agius, who brings so much to this role as our Work Health and Safety Commissioner, not just in the workplace and safety expertise, but also she started her career as a teacher. All those years ago, there's that calling of being in education, and Jackie was exactly that. Loved teaching. But sadly, a workplace incident changed all of that. So please give a big warm welcome to Jackie Agius.
Good morning, everyone. It's wonderful to be here today, and I acknowledge the Ngunnawal people, the traditional custodians of the land we meet on, and acknowledge their elders past and present. I also acknowledge any families and communities with connections to the ACT and our regions, and I welcome and acknowledge Aboriginal and Torres Strait Islander people present. Welcome everyone, and thank you Maureen and Tim for joining us here and adding your insights to our discussion this morning. When we speak about education, we're talking about early childhood right through to tertiary education, and when we speak about both in private and public sectors, and when we speak about health, we're also talking about private and public sectors. I have been a PCBU now for 5 years, and prior to that I have been an officer in previous roles. But during my time as a PCBU, my leadership team, my amazing and dedicated workforce and I have tirelessly worked to set up a safe system of work in WorkSafe. And I have seen firsthand as a PCBU the impact a safe system of work has on a workforce. And I can tell you, it is all positive. Safe and happy staff make for a great workplace culture. Recently, WorkSafe ACT participated in the South Australian University Psychosocial Safety Climate. Maureen is the driver of that work and may be speaking about some of that this morning. And I am pleased to announce that WorkSafe have been listed as high PSC, along with only 2 other organisations in Australia. And for that, I commend my workforce. You'll see them here today, our dedicated people who have come in early, and please talk to them and ask them any questions. And I'm just going to ask you to acknowledge all of the work that our communications team and our workforce have done to put this event together this morning. In relation to our safe system of work at WorkSafe, I thought that I'd just start by listing a few of the things that make up that safe system of work. And they are a risk register, consultation, HSR, a work safety group, a safety committee, standard operating procedures, clear position descriptions, PDPs, training, supervision, a rotation policy, complaints processes which are implemented and action is taken, and the continual reviewing of our systems when it comes to safety. Assessing and reviewing safety systems and controls is an expectation that all of my staff know I have of them. They also know that above everything else, and in any decision that we make, we always consider a safety element, and that is right through from implementing a new system of work, a new policy, or new procedures, including our standard operating procedures. We also have a Take 5 system, and if you're interested in what that is, have a chat with one of our inspectors and they'll explain that to you. I have set my safety expectations, and when I am not satisfied that we are doing everything possible, I intervene and I make the decision when it comes to safety. But first and foremost, I give my workforce permission to make decisions about safety and to prioritise safety, because safety must start at the top. Safety is not and can never be set and forget. This is particularly important today when it comes to workplace violence and aggression, because we know when we are in the business of people services, we cannot always control the behaviour of others. What we can do is we can put into place controls to minimise those risks. Recently, and I noticed Dave Peffer in the room, I had a trip to Canberra Hospital ED and was excited to see a number of new controls in place to minimise risks of workplace violence and aggression, including big screens with wait times, more triaging nurses available who were continually assessing patients as they were waiting. When a patient had been waiting for some time, the nurse would call them back in and give them an update. There were posters for workplace violence and aggression. There were policies of the triage policy was rolling through the screens, letting people know how they triage. And what all of this information does is it makes the patients feel more comfortable and understanding of the situation in the hospital. I'm not sure how all of that came about, but I sat there feeling extremely heartened by the changes, and I thought to myself, someone in this organisation has been reading the Psychosocial Code of Practice, because that Psychosocial Code of Practice has practical examples of controls for different industries. And if you are looking at setting up safe systems for psychosocial hazards in your workplace, I would recommend that being the first place to go. A safe workplace requires vigilance, community, and a culture that prioritises the health and safety of everyone. As the Work Health and Safety Regulator, I'd like to begin by acknowledging the vital role that both education and health sectors play in shaping the safety culture of our community. Our educators are educating our future doctors, our future cleaners, our future our future psychologists, our future teachers, our future prime ministers, and our healthcare workers are providing healthcare to our community, and we saw the absolute necessity of healthcare during the COVID era, which is continuing. And I'd remind you all to please keep your distance today, as we still have COVID in our community. But there is a growing and urgent need to address the issue of workplace violence and aggression in all workplaces. This is an issue that disproportionately affects both the education and health sectors, and alarmingly, workers in these fields are increasingly subjected to verbal abuse, threats, intimidation, physical harm, sexual harassment and sexual assault. These incidents not only endanger individual health and safety, but also undermine the broader safety culture we all as a community strive to uphold. And workplace violence covers a range of behaviours that can be a risk to the health and safety of workers. It can be one unexpected incident or a series of repeated incidents that will result in a psychological injury. And it may not be as critical or as an extreme situation, because we know psychological injuries can be compound injuries. And so if workers are exposed to a series of violent incidents over time, that can develop into a psychological injury. Overall, the most common perpetrators of workplace violence include clients, consumers, patients and students, and the most frequent behaviours from these perpetrators include shouting, swearing, intimidation and physical assault. One of the most immediate and damaging consequences of failing to properly address hazards like workplace violence and aggression is the impact on worker morale. When employees feel safe, valued and supported in the face of threats, they are more likely to if they have an injury, get well sooner and return to the workplace. And if they don't have an injury, it's most important to support them through that process so that they have time to debrief, time to recover and time away from the face of that risk. If employees feel unsafe, it can lead to disengagement, burnout and serious psychological harm, and a workplace that does not protect its people risks not only their health but also the strength and sustainability of its workforce. And I can attest to that. We've just received our workers' compensation bill, and my workers' compensation premiums have gone down because of the fact that we hope that workers in our workforce will raise issues and we deal with them immediately. According to Safe Work Australia, and I'm not sure, here we go. According to Safe Work Australia's 2024 report, workers' compensation claims related to violence and aggression have increased by 56%. And that is since 2017 and 2018. And the majority of these claims came from sectors such as health and education, where workers interact directly with the public, indicating the concerning upward trend of workplace violence and aggression. There were 53,139 accepted workers' compensation claims for being assaulted by a person or persons, and 12,721 accepted claims for exposure to workplace violence and aggression over the last 10 years. In most cases, these would have been preventable. We acknowledge the increasing pressures of modern society, which appear to be contributing to the heightened stress and anxiety and a noticeable decline in public patience and tolerance. And this is not an excuse to do safety right. It's actually a reason to do safety right, because never before have we seen the amount of incidents of workplace violence and aggression that we're seeing in our current society. It's essential that our approaches to managing workplace risks are responsive and proactive and are aligned with the realities our workers face today. In this financial year alone, WorkSafe ACT has worked on 236 cases in the education and training industry, with a quarter of them being referred to our psychosocial team, as they are related to hazards such as work-related harassment. As well, in the healthcare and social assistance industry, inspectors have worked on 241 cases, of which over half have been referred to the psychosocial team, and they are in relation to work-related harassment. So what are... we've got some more statistics there. No, why? No, that's you. I don't know. Anyway, I'll give you some actionable items or some takeaways. As the regulator, our mission is clear. Every worker, regardless of their role or industry, deserves a safe and respectful workplace. Violence and aggression are not part of the job. They are preventable hazards and must be managed with the same seriousness of any other workplace risk. Under the model legislation, employers have a legal duty to eliminate or minimise risks to health and safety, including those stemming from violence and aggression. And this means having proactive measures in place to prevent such incidents as the ones that I saw in ED just this week. A thorough risk assessment is essential when it comes to workplace violence, and if the violence is known or a foreseeable risk, don't wait for an incident to act. Put the risk assessment in place before, and as well as putting the risk assessment in place, make sure you implement it. So it's often we go into workplaces, they have all of these wonderful procedures, they have fantastic risk assessments, and then you speak to the workers, they don't know about them, they've never seen the risk assessment, they haven't been consulted in relation to it, which is actually a requirement under the Act, and no one has implemented that risk assessment. My other takeaway is that not to do it for workers, but to do it with workers. As a PCBU, you must act immediately. And any reports that you have, jump on them straight away. I've seen risk assessment, an incident occur and a risk assessment isn't written for 2 months. That's in that 2 months, so many things that could happen that will result in an injury. A risk assessment must be done straight away. In fact, I was chatting with a ACT government employee 2 weeks ago who actually works at Infrastructure Canberra, and I have noticed Gillian here, and they were going out to do some visits that were stakeholder engagement, and this person, as they were telling me about the work that they were doing, said to me, it's okay, they've done a risk assessment. And I was overjoyed, absolutely overjoyed. And I said, oh, what's this risk assessment include? It includes things like work-related violence or aggression and what we should do in those instances. But this person was an ASO 5, and they absolutely knew everything that was on that risk assessment because they'd been consulted about it. That is a huge change in what we've seen over ACT government in the 5 years that I've been in this role. Lastly, I would say if you're a PCBU in the room, make safety your business, because often PCBUs let other people do safety for them. And having been a PCBU myself, the one thing that I've learned is that if I do not involve myself and get into the nitty-gritty of safety, firstly, I don't know what's going on, and secondly, I can't give my people permission to expend resources on safety, and they may worry about that. I have said that safety starts at the top, and it is something that over the last 5 years I certainly have learned and will always stick to, because your people are only as good at safety as you are. Thank you.
Thanks so much, Jackie. So powerful. I took out so many things from that. I've written them in my merch, everybody, and I'm not hearing enough clanking of plates. I say this every time. All of that fruit has to go before anyone leaves the building. So cut up fruit is a treat. Right, just got to work this microphone out. What I got, Jackie, is that the act is such a doing word, and it has to be done. It's all good and well having it written, but you have to put it into action. And that the vigilance and community and culture to prioritise all of that to benefit, so that health and safety is of paramount importance. Moving on to our next speaker. Professor Maureen Dollard is an Australian Research Council Laureate Fellow. She has worked in this industry for decades. So as an Australian Research Council Kathleen Fitzpatrick Laureate Fellow, she's the Director of the Psychosocial Safety Climate Global Observatory at the University of South Australia. And her research has identified the corporate climate for worker psychological health. And we've heard this a lot over these breakfasts, how this is changing. Corporate values, systems, as we heard Jackie speak about, processes are crucial for getting this right, and making sure those processes are put into action, not just stuck on the back of bathroom doors. So her work has really revolutionised our approach to work-related stress, not just for the health effects of those undergoing it, but the productivity, because we want us to be doing the best job for and the people. And as we heard yesterday with the budget, the $250 healthcare levy that's going in, and if you heard Talkback Radio, it's hot. People are complaining about it, yet they complain when our healthcare services don't provide what we want them to provide. So it's that great juggle. So please give a big round of applause for Professor Dollard.
Thank you very much for the invitation to speak today. I'm coming to you from the lands of the Kaurna people, from the beautiful Adelaide Plains. And I'd like to congratulate WorkSafe ACT for their result on the psychosocial safety climate assessment that we did. One thing is that not only did they score a high result, but they had a really, really high response rate. And as a researcher in organisations, it's very hard to get a good response rate. It was like over 75%. So we're pretty, that's also telling about, what workers think of the work organisation, is how they respond to these kinds of questions. But today I need to talk to you about violence at work, which is like a very unsavoury topic for breakfast, so apologies for that in advance. But it's a very important issue. Violence and aggression in the workplace is absolutely not acceptable, and in most cases preventable. It comes in many forms: aggression, assault, abuse, harassment, bullying, and mobbing if you're in Europe. The International Labour Organisation Violence and Harassment Convention in 2019 highlights the rights of workers to be free from violence and harassment at work. And there's a commitment after that to strengthen these rights in the ILO Declaration on the Fundamental Principles and Rights of Workers, which now says that workplaces, a safe and healthy work environment is a fundamental principle and right at work. So there we have it. You know, it is a basic human right that we need to be protected from violence and harassment at work. So violence is an issue at the intersection of industrial relations and also work health and safety. And the International Labour Organisation sets out that the work health and safety framework provides a direct avenue into workplaces to address and prevent violence. So as Jackie's talked about, the Work Health and Safety Act and regulations, guidance materials and codes of practice cover duties and roles of the PCBU and worker and strategies to prevent violence and harassment through social dialogue, through collective commitment to the issue of freedom from violence and harassment at work. And workplace work health and safety policies and practices and procedures within organisations also reinforce this about the fact that workplace violence needs to be eliminated and managed. But just like violence, psychosocial risks also, need to be managed. They need to be eliminated under the Act and regulations as well. And things like low supervisor support, where you don't have your supervisor's support, low role clarity, and too much work pressure. These are kind of social, psychosocial factors at work. These are social factors that have psychological consequences. That's what psychosocial means. And they go hand in hand with issues like workplace violence. So looking at the issue of workplace violence, we also need to look at the issues of what workers are exposed to in terms of psychosocial risk factors. New forms of work, such as work intensification, digital surveillance, and poor work-life balance. These are new forms of work which also tend to increase the risk of violence at work. Working conditions that are protected under labour law, like working time, dismissals, job salaries and job security, these are also factors that can interlink to the issue of violence at work. So there's a lot of factors at work that come together. It's not just like an isolated event. There's probably a context that we need to look at. In fact, we say we must manage the risk, but we need to look at the context of the risk. So the risk is not in isolation of the context in which you find it. And this is where psychosocial safety climate is relevant, because psychosocial safety climate is about the organisational safety system, the corporate system for worker psychological health and safety. But exactly the same principles apply to the elimination or prevention of workplace violence. For example, senior management commitment and support to this issue, the prevention of it, elimination, making this a priority, senior management making this a priority, the opportunity for communication about issues that could affect you, being clear about what risks might be posed to workers in terms of violence, and also the issue of participation and consultation, which has been reinforced, and the role of multiple stakeholders in considering, what to do to prevent workplace violence, including the role of unions and also the role of health and safety representatives in this. I've noticed that the ACT government campaign against violence has case studies online, which I thought was a great idea. I thought, what could I say that could be innovative? And I thought of this idea, and then I found out you'd already done it. So very good. But they've got case studies which try to humanise the situation, to say, well, these are the workers that you might be perpetrating violence against. And I think, bringing up the human in all of this is very good. There could be videos on this as well. Public valuing of workers is really important. what's happened is the concepts of management in the private sector have been translated to the public sector. So we have new public management, that's what it's called. And under this, in the public sector, we've become more focused on client-centred approaches or customer service. So in the education department, it's student-centred. In the health sector, it's patient-centred. And I'd like to see that actually transformed to be first and foremost worker-centred. You know, we've just given too much power and control to the people that we're trying to serve, and I think we need to bring that back and value the human. So that's one major thing I think we can do. I know that in the Netherlands, I heard my colleagues saying this in the education system, in the higher education system, this is exactly what they're trying to do. Actions to prevent workplace violence, we need to ask workers to assist us in identifying risks and solution and provide a way for workers to report violence safely, including domestic violence. And, at the moment, we've got a lot of mechanisms in place, but actually really do they work? What happens when something catastrophic like violence occurs? I noticed that they must immediately, workers need to report this to the organisation and then also to contact WorkSafe ACT, and then I guess the inspectors come along, but all of these public services are, under pressure, and, we need to think of other ways of handling this. In terms of, I see that I'm almost running out of time, but I have a few more points. In terms of managing customer expectations, what happens in the hospital, installing physical barriers, etc. I see in the transport service here on the buses, you've got quite a lot of protections. How to consider reducing customer frustrations. And note that there are some cost-cutting strategies that are implemented in an organisation that cause frustration to customers. For example, call centres, this can sometimes be extremely frustrating. And so customers need to be fully informed of reasons of delays, changes to services and so on. And the International Labour Organisation has announced that they are working on a statistical standard to assess the nature, extent, or impact of work-related violence across the world. And I think that workers could act as citizen scientists in their organisations to assess who, what, where, when, why violence occurs so that it can be prevented in the future. So to kind of socialise the situation and get workers to inform what's going on. As we do have... I think in Australia, pretty good systems, but whether or not those systems get enacted is what we are concerned about. And that's what psychosocial safety climate does, is tries to look from the bottom up, how are workers seeing this situation? And I see a ruling in the Fair Work Commission just yesterday that somebody was aggressive to a manager, to a worker, the worker left, it was unfair dismissal, and the Fair Work Commissioner said, even though you had policies about workplace aggression, this worker didn't know about them, wasn't told about them, so there is this obligation to workers. So just back to the humanity of organisations, the very first study I was ever involved in was in the Department of Correctional Services, and this person had been on workers' compensation and told me how things used to be and how there was this level of care and humanity in organisations. It's from 1972. He showed me this letter. It goes, "Dear Mr. Smith, we were very sorry to hear of your recent illness. On behalf of the staff, I extend to you our best wishes for a speedy recovery, and we look forward to seeing you back at the office in the near future. Yours sincerely, Deputy Director General." And I think this kind of knowing workers, knowing what's going on, being closer to them, valuing them is part of the solution here. So overall, we need to be on alert and learn new ways to prevent workplace violence and harassment, which unfortunately does seem to be on the increase. Thank you very much.
Thank you, Maureen. What a lovely letter to get. Can you imagine that coming now? I'd like to think it still happens in workplaces. That little bit of recognition and consideration, the level of care and humanity, it was really highlighted. Now, it's to our next speaker. Tim Cleary is the principal at St Edmunds College. Now, Tim has been in the education business for many years, I think over around 40 years. He started at Eddie's in 1986 as his first year out at teaching and has come full circle back as the top of the tree. But I think as a school principal, you're never the top of the tree. You're very much, still very much doing the job that you started 40 years ago. So it's really wonderful that we've got Tim with us today, skilled in negotiation, non-executive director, lesson planning, educational technology, strategic leadership, but also just on the ground. Certainly when students, we heard earlier this year with students hit out the front of the school, what an alarming incident for your first duty pretty much in front of the public, Tim. But I've also learned about Tim is that he doesn't just know about education, but he also knows the Pope personally. So that's a pretty big claim to fame as well. Please give a big round of applause for Tim Cleary.
Thank you, Liz. Thank you and good morning, everyone. Thank you for having me, Jackie. Look, I'm going to, of course, you're never the boss when you're the principal. I have a wife. And my wife works in this space in health. We could have had a double act this morning. We often hear Mr. Peffer's policies and protocols because my wife works in a task of work safety against violence in hospitals. She's very proud when we go to the hospital because she sees the posters and all of the things that she's been working on in action. But it's my pleasure to be here. I'll just share a couple of anecdotes with you this morning. I grew up in Canberra and it's been a wonderful journey for me to grow up in Canberra and to leave Canberra for a fair amount of time and come back. This is my 20th year as a school principal. I've been a director of education, of Catholic education in Sydney for a couple of years. Earlier in my career I was a federal policeman as an investigator. And so I've seen an amazing amount of change, not only in the landscape of Canberra, the cranes in the sky and the buildings. I think when my mum and dad arrived in Canberra, there were 55,000 people. And now, of course, it's unrecognisable to me. Some of the suburbs, when I came back to Canberra, I hadn't heard of before. So there's a lot of growth. There's a lot of people coming to Canberra. The projections are pretty extraordinary. As you would have seen yesterday in ACT's budget, they're preparing for many more people to come to Canberra, and so that will bring its rewards, and certainly it'll bring its challenges. Isn't it amazing that we're talking psychosocial climate in the workspace, and that's a good thing. But I can tell you that I'm very proud, you should all be proud of how far we've come. In schools, things can go wrong very quickly. I grew up in the 80s, the magnificent 80s in Canberra, and I remember being a Year 9 student, going to school on the bus with my .22 calibre rifle, with 50 other boys who would arrive at school. We'd put our rifle behind the year coordinator's door. Anyone would call that a militia, I would think. And we'd go to target practice out at one of the ranges every day. That's unheard of, unspeakable, that people would let a 14, 15-year-old boy bring a rifle to school, let alone 50 of us. On other days, we'd get in the back of a Pantech truck and drive up the highway and go horse riding. No seat belts, no safety, nothing. And so we've come a long way. Certainly, I would also outline the fact that in the old days, we had violence directed at students to modify behaviour. Sometimes we gave a strap or a cane to someone who was often unhinged themselves and let them unleash on a child. Thank God those days are over. That's something that we certainly some of you in the room would have horrible memories of. So now we're up to planning for the worst. Often in schools we have to make sure that we're vigilant, not hyper-vigilant, but we certainly know things can go wrong very quickly. And I'll talk about the 28th of March very soon, when 2 of our boys were struck by a car out the front of at the school on Canberra Avenue. But I remember health and safety has always been spoken about. I remember probably in the early 90s we had a WorkSafe people come to the school. I was the acting headmaster at the time, and I saw a big ladder come up on the third. I was on the third level. I saw a ladder come up, leaned against a flagpole, and I was trying to make the WorkSafe people make eye contact with me so they didn't turn around, because there was one of our old gardeners climbing a ladder by himself, completely unhinged and unroped, and these things were done all the time. People took risks. People didn't think about the mitigating factors of injury. I'm here just to say that risk assessments are important. A plan for a critical incident is also important to work backwards from that. We've unfortunately had to activate a critical response when 2 of our boys were struck, knocked over 30 metres on Canberra Avenue by an allegedly stolen vehicle, and the boys were smashed and on the ground, and we had our staff as first responders, and that critical incident certainly took its toll on our community. Psychosocial well-being then kicks in very much, and we're still picking up the pieces for some people. It's very difficult to see your boys. Interestingly, there was probably 3 fire crews there very quickly, and some of them couldn't get out of the truck because they were old boys of the school who saw themselves, their mates in their uniform, and one of the boys, was in such a state that he bled out basically, and was saved by the ambulance at the scene. So, things go wrong in schools, things go wrong in the workplace. You need to mitigate the risks. You need to understand, especially working with children, that things can go wrong. I was interested to hear that when you do that, you have the obligation, when you do the assessments of risk, that you do share that with the staff. One of the great case laws comes from Western Australia, where the teachers took children to the beach, got them to write down everything that how far they could swim, how far they could dance, put it in a folder. The teachers had a grand old day. One of the children drowned, and they went, oh, we forgot to look and see who. They actually collected the information, but didn't actually do anything with the information. So it's all well and good to make plans, to activate a good intention, but you have an obligation to make sure that what you're collecting, what you're mitigating against, is shared, spoken about, and understood. And so that's one of my great learnings, I suppose. I'd also say that I saw the psychosocial health in New South Wales last year tried to legislate, and it was still got some work to do on that, because it's difficult. I can tell you as a principal, what I'm seeing now is sometimes people understanding and knowing their rights can be problematic to the extent that they will weaponise some of the public mechanisms to get what they want. They can go, there's a lot of government places that people, if they're not happy, they can mistake being really what is supervision, what is necessary discipline to workplace bullying. It's a fine line. And there's a lot of work that I've had to do over recent years in preparing briefs to support my staff who've had allegations made against them for what I think were reasonable actions in educating, in my case, young men. Very difficult for those teachers who have things foisted upon them when they were really trying to do their job, and they were doing the right thing. Again, on the other side of things, we have to be vigilant to make sure that, and fulfil our obligations to make sure that we are doing the right thing at all time. Now, I'm just here to do the introduction this morning, so my time's up already. I have got so many stories. So many of them are wonderful. So many of them are life-giving to the communities that I've served in, and also to the community of Canberra. I would say one of my big beliefs in representing schools and children and staff, many staff, is I've asked all my staff to join a union, because in joining a union you're able to be represented, you have strength together, it keeps everyone reasonable and fair. And so I'm not here to proliferate the labour movement, or other than to say I'm here to support workers, I'm here to support children, and I'm loving being back in Canberra. Thank you very much.
Thank you so much, Tim. I really liked you saying that fine line between what's reasonable management in certainly in education and teaching, and what is unreasonable, and stepping across the line. And I think navigating that for all of you must be so hard, and communicating it as well to know what is reasonable and what is not. I think we'll just take a quick 5-minute break so that you can go and top up your coffee, finish eating, go to the bathrooms if you need, and also to scan the QR code and test that it works, and to get any questions in. And then we'll come back, and it'll be your opportunity to hear from those speakers and ask any questions, share your own experiences and challenges and what you would like clarified, because I think it is, there's so many, no doubt, that you have. So please take a moment, and we'll be back in about 5 minutes' time. So we might kick it off. Put your questions to the QR code. Just scan it there. Is everybody okay with the scanning of the QR code? You're all able to ask your questions. If not, just raise your hand and a microphone will come to you. We'll get straight into it, I think. I don't think there's ever any shortage of questions. So we'll kick off. How can educational institutions ensure the safety of their teachers from occupational violence by children and parents? I'll ask that to Tim.
Okay, good one. How can education ensure safety of teachers? Well, it's making rules very clear and expectations very clear. We've got an enrolment policy which is critical. It's like an employment contract, I suppose, when you employ people. You make expectations very clear and well understood, and there's zero tolerance for violence. So I think that's the main one for us. Interestingly, the children aren't the issue for us in schools. The children they're compliant, they want to please, but they just need to know the rules. If people, clear communication is the answer to that, and a good contract at the front end that you can hold people to account. So that behaviours and expectations are understood, and when the lines are crossed, it's called out.
How do you manage that, Jackie? You were saying when you went to ED the other day, it was clear the expectations of behaviour, but also how you manage it. I wonder, yes, from your perspective, but also from Tim, how do you communicate that expectation to parents?
Well, regular communication. It's interesting. I was asked recently, when did you last speak to parents about expectations of their behaviour on the sideline at a football game? You have to regularly communicate the same thing over and over as if it's the first time they've heard it, because often it is. And so you have to, we've got publications, we publish it, we've got websites, we have to publish it, and we have parent night. So you just have to communicate. It's a consistent narrative, clear expectations. In the end, it's almost eye-rolling, but it has to be done.
Anything to add, Jackie?
Only that it's really important. I gave some examples of a safe system of work, that safe system of work exists in every single education facility in the organisation and that it's implemented. Sometimes we're seeing things happen at that organisational level, but they're not happening in the education facility, and they're not prioritised by the education facility. So we want to see all education facilities with a safe system of work in place and that system implemented.
And that safe system of work, because is it a complaints process as well? So if the staff member is feeling uncomfortable,
that's absolutely part of it. Absolutely, you must have. And the other thing about a complaints process, Lish, is not only that you have it, but then when workers make a safety incident report, that is acted on immediately. And, you know, you can do it in education facilities. In my workplace, as soon as someone puts in notifies us of a risk, I go and have a conversation with them and I say to them, I'm really sorry about this. Is everything being done for you? What can we do more? Is there any leave you need? So it's managed right from the top down to the bottom.
If anyone has experience in their workplace, whether it's a private or a public setting, please put it on the Slido as well of how you have managed, if there's been a process or a plan that you've put in place, because it's really, really valuable. It's like live talkback radio. But
can I make one more comment, Lish? And this may be a little bit harder for Tim. I'm not sure how it works. But we talk about violence of parents. And what I often hear is, you know, that students have a right to education, and they absolutely have a right to education. They don't necessarily have a right to a particular school, but parents don't have a right to education because they've already been through school. And so I know schools want to be this, part of the community, and that's really important. But if you have parents who are engaging in aggressive and violent behaviour, there are mechanisms that can be used to ban them from the school.
Maureen's worker-centric message. How can we be worker-centric when patients and students are traditionally seen as the focus in those industries?
Well, I think this is just a matter of people changing their minds about the focus. So it's by human design that we have been really focused on, providing a service to patients and to students. And, we had this student-centric, patient-centric process. But I think that we need to reinforce a worker-centric focus as far as work health and safety goes. So, it's just a matter of, somebody changing their minds and reinforcing the value of the worker. You see them in value statements, like we value our workers, don't abuse them, that sort of thing. So that's part of it. But there could be more of that. That could be right at the front of the school gate, for example. Violence will not be tolerated.
And we're in education and health are in the business of caring. There is a wonderful example of being in the business of caring, and it's universally known, and that is whenever we get on an aeroplane and they talk about oxygen, the oxygen mask, they always say, put your oxygen mask on before you help others. And why do they say that? Because if you can't breathe, you cannot care for anyone else. And I would love to see that universal language across all carer industries. Because a doctor, a nurse, an educator, a teacher, a lecturer cannot support their students unless they are safe.
But often the carer is the person that won't call it out, though, because they've gone into that industry in the first place, the profession. Tim, how are you dealing with the influence of Andrew Tate and the like on young, impressionable minds at school, in particular, the impact on female teachers?
Well, a good question. First of all, at St Edmunds, our teachers, we've got 96 staff. The majority of our staff are female in an all-boys school. So that's been a deliberate action over some years, affirmative action. Andrew Tate is... he is who he is, and he's not in our river. We talk about different streams of thought and different ways of elevating ourselves as young men and as adult men who are going to be good and spirited people who make a good contribution to life, and he's not in our stream. There are a lot of rivers, there's a lot of streams, but we call them out. There's that toxic masculinity label, which is a terrible one to be levelled at anyone, but that's where you'll find it. That's the river, that's the stream. And so what we do is we call it out. We talk about the different streams of thought. There are different things happening in the world at the moment that we don't have to agree with. And if you call them out, you're labelled as an extremist or something else. So it's about brave conversations, about a narrative that they know who this person is and what he represents, and then what we represent. What are our core beliefs? What do we believe in? And that doesn't fit in with any of it.
Does that come from you as the principal, or the female teachers?
Well, you know what's interesting? I was at St Eddie's as the deputy from 1997 to 2001. Went away for 20 years, came back. So I've seen 4 different epochs at Eddie's, and it has changed, not only because society's changed since I've come back, but also because the influence of the leaders in the school, most of them, are female, and the conversations are different, and they call out good behaviour and bad behaviour. It comes from me. I mean, at the end of the day, I'm the leader. I'm responsible if things are going pear-shaped. The first person they point the finger at is the boss. And so, but it's who we are as in our faith, and with faith leadership. It's also in my history, and it's in our DNA. So I'm calling out bad behaviour. It's a collective responsibility. Everyone's responsible for that. And the boys get it. They know. I would doubt very much whether we would have anyone that didn't know what that man represented.
If you have a follow-up question you'd like to ask, do put it on the Slido. So if you want any expansion. Thank you, Tim. Will events like today be impacted by the government's budget cuts announced yesterday?
Probably. We haven't assessed the impact of the budget cuts, but we are, as a senior leadership team, looking at that, and we will need to make some cuts. These events are extremely important to us at WorkSafe. They are one of our priorities, and we will continue to try and prioritise them. But, we are part of our society and community, and we live and work in Canberra, and all of us are needing to make hard decisions to support our community at this time. Do I like it? Absolutely not. Be really clear with you. I'm not as angry about the health levy as other people that I've heard in the community. I think that, we're very lucky. We are extremely lucky in Australia. We have a health system that is mostly free. We have an education system that's mostly free if it's public education, and we need to value that, and all of us need to band together to support those essential services in our community. But obviously my business is safety, and we don't like losing any money, as I'm sure other directorates are in the same position. But we're all paying for some of the decisions that were made during the pandemic, and that was a very difficult time for our community. But these breakfasts will be prioritised because we consider them to be important stakeholder and education events.
I'm also going to point to the podcast that WorkSafe ACT is putting out, Safety Spotlight. It's fantastic. Honestly, I used to think safety was boring. Like when I was just doing, guaranteed, when you're doing the training and you see the posters, extraordinary and so relevant, whether it's the older you get or you have your own experience, knowing how important it is that employees have access to the information, know the work health and safety officer in there. But the podcast is also brilliant. In fact, tomorrow, Maureen is going to be recording one on this. So share that widely as well. How can we effectively identify, address and manage workplace inclusivity incivility categorised as low intensity and subtle behaviours in the healthcare sector? Maureen?
Okay. It's interesting. There is an intervention going on in one of the hospitals in Adelaide, and it involves, like somebody with some responsibility for observing this, for workers to report to this person, and for this person to then be able to talk to the offending character, so that there is this kind of like control going on at a local level, saying to someone, look, when we were in the middle of that operation and you said those things, that was quite offensive to several people. So it's like really addressing it immediately, addressing it at a local level. It's, people that you're working with saying that what you said wasn't appropriate, so it's maybe a little bit more powerful. That's one example I can give.
Anyone else want to add there?
And there is a requirement in the Work Health and Safety Act for workers not to do something or not to fail to do something that puts others at risk. I agree with what Maureen said in calling it out. It's really, really important. We're all adults in workplaces. We should be able to have a conversation with someone else and say to them, look, I found that offensive. And in most occasions you will find that the person will apologise and say, oh, I'm sorry, I wasn't thinking, or I was, I'm really under stress. Those sorts of behaviours are less likely if you have a safe system of work and you implement it. So we know in relation to psychosocial hazards that behaviours such as those come out when people are under stress and are not being kept safe in their workplace.
You've just done a big report, Maureen, of which you said that WorkSafe ACT was at the top. Yeah. What do you see from the bottom level? Is it this sort of incivility, or is it a bigger issue?
Definitely, when there is a very low psychosocial safety climate, there are many, many, many problems. So if you assess the psychosocial safety climate, those things that I said before about top management support for stress prevention, about prioritising worker psychological health over productivity, that's key. The opportunity for communication and the opportunity for participation and consultation. When you know about those things, you can predict behaviours. You can predict future incivility, future work pressure, future bullying and violence. So you can assess it. The thing is that you don't really know who's actually doing it from such a survey. You can also ask questions directly about incivility, bullying, harassment, that sort of thing, and violence. And you can see which areas might be exposed, but still you still don't know then who the perpetrator is or what's going on. So you have to go and start talking and, have meetings to find out what's really going on.
And there are so many things we can do in relation to that sort of conduct. So having a diverse workforce is really, really important. Celebrating that diversity. helping people to understand cultural differences, helping people to understand gendered and sexual differences. And one of the engineering controls, and of course that's one of the lower controls that we have in place in relation to that sort of conduct, is we do every year a Respect at Work courses, and there are the trainer that comes in and does that with our staff has case studies and how some people find things more offensive than others. And just to give you a little example of that as quickly as I can, in some communities in Australia, people might say the word fart and it's acceptable. And I apologise if I've offended anyone for using that word. But in other families and communities in Australia, that would be a totally unacceptable word. And they're the sorts of things we need to think about when we are in a workplace, and that respectful conduct and behaviour is really important. One of the things that we have in place in our workplace is there's no swearing. Because some people tolerate swearing, others don't tolerate swearing, and so we have a rule, no swearing.
I imagine that's not at your workplace, Tim. Very, very hard to manage that. But I think, Tim, this leans into what you were talking about. Is there any evidence, and Maureen, I'd love your input, that supports the belief that workers can weaponise their rights? Or is this a myth used to dismiss serious allegations? You were talking about the thin line between reasonable management and knowing the rights. Who'd like to take that one?
Look, I'm not sure. I don't think it's so much the workers weaponising their rights. I think it's the parents who are coming back the other way. I can give you so many examples. Do I think there's evidence? Yes, I do. I've seen it. Reaching out and offering help to families. I was accused of demeaning a person because I offered them extra support and help because the child was I asked the parent to go and get them checked for diabetes because the child was going to the toilet 8 times in a day, wetting their pants, doing all this, and they made a complaint to the Human Rights Commission. And I had a case to answer, a lot of paperwork for offering support. That was because they would, I call it kindergarten camouflage, trying to hide something else. Don't you make a report on how I'm caring for my children, but I'm going to go you first before you get the chance to go me. It's a child, that's what kids do. What about them? They did it first. Everyone's doing it. That sort of mentality, and so how do they put a wall between us and their responsibilities? They make a claim. So we've seen it weaponised, and then you've got to answer a lot of questions. Not so much the workers, although the workers you would know, which goes into my next one. The major hurdle is being present and at work. That's the thing that helps them weaponise. They can withdraw their labour. They cannot be at work. And if they're not, and it can be genuine and legitimate because they're hurt emotionally, socially, psychologically, or they don't like what they've been told to do, and they can withdraw their labour. And we know in schools, moving the dial, the biggest thing you can do to move the dial educationally for outcomes is to be staff presence, number one. Second is student presence.
When you say presence, actually showing up.
Showing up for work.
And being not just a warm body, but
not
an
being
actual...
a warm body, but, well, number one, being there. It doesn't matter what you do, as long as you're there. But then, then it goes to staffing levels. I mean, I can talk all day about that, but staffing levels, not only in schools, in hospitals, in wards, in faculties, with the right mix of skills.
Maureen, would you like to add to that? Because I think would you make that same call next time? Because once someone has had that sort of experience, would you call it out again? And do you find managers don't call out behaviour because they're afraid to be taken.
I think so. I think so. It's much easier to ignore something than it is to challenge something. So much easier now, and people get wounded. Not again. I can stand there watching a teacher talking to a boy, and this is a little thing, but it's an example of a boy can have his tie down, his shirt out, and be chewing gum and talking to a teacher. You go, well, that's not our expectations. That's not what we asked them to do. That's not how we asked them to present. But it's so much easier not to say anything, because otherwise they'll get in a fight, or the parents will go to them at the football on the weekend. How dare you speak to my child like that? You spoke in an aggressive manner to my child. No, I actually didn't. I just told them to tuck their shirt in, pull their tie up, and not to be chewing gum. There's a lot there that I've seen a lot change, and I know that some people hold the line. I remember. Can I just diverge for 1 second? I remember when I joined the police force. I was a young teacher. I was too young to start teaching. I was 20 when I started teaching, and I'll never forget. When I decided to join the police force was when I watched the police at the stairs of Melbourne Parliament House when the BLF were marching, and the police were holding arms, and this guy was getting pummeled. He was getting punched in the face, and he held the line. And that's what you have to do in the workplace. You have to have your heroes. You have to have your people who have got a very clear understanding and a narrative, and you have to ask people to hold the line. These are our expectations. They're shared expectations.
Unless they're getting punched in the face.
Unless they're getting punched in the face. No one should ever have to get punched in the face. I don't know what I was thinking that I thought that I should be that person.
Oh, the good
Maureen,
old days.
Yeah, just about weaponising, and maybe that's not such a big thing that we need to worry about so much. But I think the fear of actually picking someone up on an issue is real, I think, and the way to handle it is to kind of do it in pairs, or to talk to someone about what you are seeing and observing and what the strategy might be. So just sharing it, like if you feel something, if you feel bad about something, I think that you can guarantee that other people will feel the same if you would talk to them. Like, a lot of us are embarrassed to sort of say something to someone else about our own feelings about a situation. But I find that as soon as you do that, you generally find other people are in agreement, and then together you can act. So to avoid being accused of something, to try and do it together, I think is a good strategy.
Can I add to that one? I just think that this sort of discourse is really unhelpful. Speaking about weaponising safety, or using other people using it as an excuse not to address serious incidents. The fact is, if someone has made a report under the Work Health and Safety Act, you are required to address whatever it is they've reported. The reason for them reporting doesn't come into it at all. The risk assessment is that may come into it, and another part of the organisation that might be something to do with HR or something else. It absolutely has nothing to do with work health and safety. If someone reports a risk, you must address it. It's that simple.
Thanks, Jackie. I know we've reached our 8:30 timeline. And I think the WorkSafe ACT staff will answer these questions and put them up on their website, the communications team. Is in the questions you see here before you, if there was one major hurdle you commonly see arise in WHS, either health or education, what is it, and how would you like to see it addressed and fixed? There's also given the amount of compounding cases that can occur in health, how can workers be truly protected against psychosocial triggers, or is it just part of the job, like the holding the line, Tim, and those frontline workers, literally those frontline work, and the job, how much is it part of the job and how much is it not? And Tim, there's one for you there as well. Take your pick, my fabulous guests. I'd like to know from you what your biggest issue you'd like people to take away from this morning is.
The first one about the major hurdle commonly arising in work health and safety is people being afraid to use the safety system. When something occurs, they don't know how to report, and they're afraid of repercussions if they do make reports. So that, I think, is a major hurdle. And the other one is the disconnect between the most senior management in an organisation and the workers. Like, there is a big social disconnect between those two levels, I think. They are my views.
Tim, would you like to take on any of those?
Oh well, I just think one of the commonly expressed frustrations of leaders in education is staffing, the levels of staffing, the staffing mixes, and then ensuring that people look. I've got to get the perspective of WorkSafe. Mine's more of culture, work culture, and so everything with WorkSafe with children is critical mass. Mine's the cultural mix. We've embedded. I think we've embedded the safety elements so well in schools, and I saw it in a critical incident recently, as I said. But just the whole thing about how we speak to one another, how we speak to the boys, and how we express our expectations, and turning up.
Turning up. Jackie?
Oh gosh, I feel like a duck at the moment because my legs are going, there are so many things. I don't know how to answer this question. It's like...
Podcast. We're recording a podcast tomorrow, and I was thinking a lot of these we'll address on the podcast because there's some great questions.
I do have one, though, that I think we often fail to recognise in Australia, and in this role I've been fortunate enough to speak at some overseas conferences and have had... quite a lot to do with the occupational hygienists associations in different countries. And the one thing that we are significantly missing here in Australia is using occupational hygienists as our safety experts in our workplaces. What we tend to do is we think our HR people are our safety people, and we put all of those things into one basket instead of separating them out so that we have clear safety procedures. Occupational hygienists, and we have a few of them, we have I think one now in our organisation who's currently doing a master's, who was telling me about some of his current courses on risk assessments. If you can employ an occupational hygienist, or a few of them if you're in a larger organisation, to look after your safety, they are absolutely crucial to helping you resolve your safety issues. They know everything about chemicals. We know schools and hospitals both have a lot of chemical use in labs and even in your radiation rooms. They know how to do a risk assessment better than anyone. I would say let's forget about these generalist HR people that are also doing safety, and let's get some true safety experts in your organisations.
Thank you all, and thank you for bringing each area of expertise from Maureen, from the research and all those years of research, Tim on the ground and creating a culture that improves safety, and Jackie from the regulatory and all your work in that frame. And thank you everyone for bringing all your questions. Feel free to stay and chit-chat as well as adding questions. We will put that up on the WorkSafe ACT website, and also we are recording a podcast tomorrow, so we'll pick those through as well and put those together.
And thank you, Lish, as always.
My pleasure.
Come to us with so much energy and make everybody feel great first thing in the morning.
I think a lot of it is about communication and making this such an important issue, because it is. If you go home sick from whether a physical injury or a mental injury, that is no good to anyone. No good to the workplace, no good to your family and relationships, and no good to society. So I'm all about it now. I feel like a born-again safety expert. And thank you to the WorkSafe ACT staff and everyone putting it on here today, including the QT staff. Thanks for coming out. Go forth and don't slip on the way out. I mean, yeah, this is WorkSafe.